Welcome to the Body Shop Physical Therapy. Today I'm going to share with you my pre-workout or pre-run routine to help keep me injury-free with running. It is 5 o'clock in the morning. Everybody's sleeping, and I'm just going to go through this routine to prepare myself for a good, pain-free run. The rule of thumb that I follow is release and stretch and then strengthen, and the running is the rehab. It is going to be the strengthening portion, is just getting out and getting that run in. So the release and the stretching is going to prepare the body for that, to get it balanced and to release any problem areas so that if there is a weak link, I can avoid an injury. And so I'm going to take you through this. The first area that I'm going to start with is going to be my hip flexor. I used to use a lacrosse ball to release my hip flexor. Now I have found this tool. It is called a hip hook. It was developed by a physical therapist. Her name is Christine Kopp, and I'll put the link below if you're interested in learning more about this. So the first area that I'm going to release are going to be my hip flexors. The hip flexors are involved in a lot of the power with running, and if they're tight, then we lose some of that power. And so that's where I'm going to start. The placement of this, so this is going to be a hook that's going to press right into the muscle. Pressure on the muscle can release any tension and trigger points in those areas. So what you want to do is find the hip bone and then come right in line with the nipple region. That is where the placement's going to be. So I'm going to take the hip hook, I'm going to place it there, and then I'm going to lie onto my stomach and just put pressure right down onto that hip flexor. Now, if it's tight or it's hasn't been addressed, it can be really tender. So it may be difficult to relax into it, and you want to ease your body into it. You don't want to tense up. So if you can just tolerate a little bit of pressure, try to just hold your body and then slowly sink down into it. Now there's this little lever on the side, and when I take my hand and I press there, it's going to take that hook and push it into the iliacus portion of the iliopsoas, and that is going to be a portion of the hip flexor that's going to be released as well. So I start here releasing my hip flexor. You just want to hold until you feel that your body melt and sink down into it. Or you'll also feel some tenderness subside if that trigger point is being released in that iliopsoas region. You can work all along that area. I like to bring the hook down a little bit lower and then push into that inside region on that iliacus portion to really get that to release. And Christine Kopp has different positions you can put your leg in to release different areas of that hip flexor. So I would check her out and look into this device if you're an avid runner or just looking to have a device that's going to effectively release the hip flexors. And then I'm just going to go onto the other side and come down onto that hook and relax down. Now I can roll to my side, place it, and then gently roll onto that hook. You may find that one side is more tense than the other, so you'll spend more time on that side to release that area. And again, you can move that hook region along that muscle. The psoas portion goes from the low back down into the inner groin area called the lesser trochanter, and then the iliacus portion goes from the inside of the ilium, which is that hip bone, that muscle that lies right in the inside, kind of like the inside of a bowl. It's going to also attach to the groin region and on the bone of the femur called the lesser trochanter. And so I'm going to do the same thing. I'm going to move that to a little bit closer to that iliacus and then press and release that muscle there. So I'm just releasing the hip flexor. If the hip flexors are tight, it can change the mechanics in the whole lower extremity. So it's really good to address this muscle to help balance the legs. And so even some unsuspecting causes for knee pain can come from the hip flexor. So after I've released the hip flexor, I'm then going to stretch it. So I like to go into a lizard stretch or hip flexor stretch and work my elbows down. I usually feel a strong stretch on the inner groin of the leg that's in front, and then a stretch on the front of the back leg. And I just want to hold that and release the tension there. I'll hold anywhere from 30 seconds to a minute. And then I'll switch to the other side. And same thing, I'll just hold anywhere from 30 seconds to a minute. And I'll alternate back and forth until I've gone through 3 repetitions of stretches on each side. And so for the sake of time, I'm going to alternate a little quicker, but go through just to show you. And you can spend as much time as you need to. You don't want to overstretch. If you do 3 times 1 minute, that usually gets the most out of your body for that particular time period. You can overstretch and end up having some cellular damage, and you want to avoid that. And switching. Now today what I'm going to use is you do not necessarily need all these various items. It is nice to have some type of tool to be able to release the muscles, but again, this is the hip hook. I am going to use a double lacrosse ball, a plain lacrosse ball, and then this is a heated roller, so it's got heat in it. You can use a foam roller. I have progressed to a little harder surface area, so I'll use the more firm roller, and alternating back for my last one. So just stretching that hip flexor. And this is one of the hip flexors. There's other hip flexors as well that we're going to get to. And then alternating. And the last time on this side. And there is there's a running syndrome that can occur, and that's called snapping hip syndrome, and it's beneficial to release the hip flexors if you have that snapping in your hip. All right, then what I'm going to do is I'm going to work my way down, and I'm going to roll my quadriceps. So that's going to be the muscle that goes from the very front of the hip down across the knee and attaches to the tibial tubercle. And that's going to be on my tibia. So I am just going to slowly just investigate, see if I have any tight or tender areas. Usually this feels good. So then I'm going to angle onto my side. And I'm going to roll my IT band, and the vastus lateralis, the outside of the quadricep, is going to usually have adhesions with the IT band, so it's kind of blends in, and so that can be really tender, and it's a good place to release any tension there. Okay. If I feel any tenderness, what I'll do is I'll bend my knee and then straighten it to actively release the tension in that area. And then I'll go all the way up to the top, but I don't want to roll over bone. I just want to stay on the connective tissue. bone is connective tissue, but we want to be on soft connective tissue. Stay away from the... And then I'm going to switch to the other side. And just release the tension along the place between the vastus lateralis, part of the quadriceps muscle, and the IT band. And if I feel any tenderness or tension, I'm going to hold there and bend and straighten. And just work my way down. All right. So after I've rolled my IT band and that vastus lateralis, I'm then going to use a single lacrosse ball, and I'm going to go right onto the tensor fasciae lata muscle. So if I come to the front of my hip and I just go down slightly, I'm going to run into some muscle tissue, and that is going to attach to the IT band up high, and I'm going to place that there. So I'm then going to angle my body onto that, and if I find an area that's tight, I'm going to hold there, and then I'm going to bring my leg up and then rotate and let that foot fall back down to the floor. And so the tensor fasciae lata is also a hip flexor. It internally rotates the hip, and it also abducts it, so it allows the leg to go out away from the body. But it's also going to be part of the hip movement in the rotational. And just holding that and releasing the tension there. So then after what I release my quadriceps and my tensor fascia, I do a combined stretch to get both of those areas. So then I'm going to go into the other side. Same thing, I'm going to find my front of my hip bone, and I'm going to just go down from there onto that muscle. And I'm going to angle my body so that I can find pressure to place on there. And this muscle can be a culprit for low back pain. So you're releasing trigger points that can be part of the back. So this is also going to keep your back healthy. And then I'm going to bend that knee and then let that foot just rotate. And it can be really intense depending. So it takes time to work on getting these muscle tendon and don't forget to breathe, trying to relax into and release those areas. Okay. Then I'm going to go into a combined stretch, and I'm going to go back into that same hip flexor stretch, but this time I'm going to bring my heel to my buttocks. And when I do that, I should feel the stretch on the front of the thigh and then all the way up into that tensor fascia that I just released with the lacrosse ball. So I'm just going to stretch here, holding it again anywhere from 30 seconds to a minute, and then switching. And same thing, bringing that leg up, grabbing my foot, and bringing my heel to my buttocks. Now, if you want to get this stretch, but it's too difficult to grab here, you can loop a dog leash or strap around your foot and then bring it across your shoulder, and then you can just hold it as far as you can. but you don't want to force yourself into a stretch. You want your body to ease into it. And if you do the releases before you stretch, you will find that stretch is as more pleasant, so you'll find that you get to get into those positions with more ease, and the stretch becomes more effective. And so, and again, switching. Now this is also going to keep the knee healthy, so you want to stretch the muscles that cross the knee joint. So one of those is the quadriceps, and so quad stretches are important to do prior to your run. Now stretching is more effective after you run, but I do like to prepare the body with flexibility before taking off. And everybody's body is different. So some will respond differently. And if you're an unbendy person, you can do the releases and find that you can actually stretch and get some flexibility where you felt you might not have any. And just holding these. Make sure you take deep breaths. And this is the last one I'll do on this side. So again, 3 stretches each. The next area that I'm going to release are going to be my hamstrings. So that's going to be the muscle on the back side of the thigh. And what I'll do is I'll just cross one leg over the other, and I'll just roll and mobilize that connective tissue and muscle on the back side of my leg. And if I find any area that seems to be tight or tender, I'll just relax down and then straighten the leg, and then actively release that hamstring, and then switch to the other side. And just mobilizing. And after I do that, I'm then just going to lean forward and stretch my hamstrings this way. Taking a deep breath in, all the way out. And just forward folding, taking a deep breath in, all the way out. And this stretch feels really good to me. And you're getting the whole back line too. I'm getting some stretch in my back. I'm getting some stretch in my calf region. And can feel it all the way down to the bottom of the foot. And then coming up, taking a deep breath. And forward folding again. Deep breath in. And last deep breath in. And coming back up. And again, this muscle is going to be one that crosses the knee joint, so it's going to be a great stretch to do prior to running to keep the knees healthy. And taking a deep breath in, all the way out. Deep breath in, all the way out. And deep breath in, and all the way out. Next, what I find that has been beneficial too for the flexibility in the knee is to work on releasing the areas in both the shin and the calf region. So I'm going to take my single lacrosse ball and place it right underneath my calf, and I'm just going to go parallel with the muscle belly, and then I will stop and go back perpendicular and release some of the tension on the gastrocnemius, or the calf area, and that muscle is going to cross the knee, and it's important to release to keep the knees healthy as well. And the very outer portion of the calf muscle, it is actually going to attach to a part of the outside of the knee called the Arcuate Complex. It has 4 different structures attached there, and one of them is the lateral head of the gastroc. So by releasing that outside part of your calf muscle, you are changing the pull on the knee on the outside there. And so then I'm just going to switch to the other side and mobilize that calf tissue again, checking the outside. Okay. After I've mobilized the calf, I'm going to take my double lacrosse balls and I'm going to mobilize the peroneals. So this is part of the lateral anatomy train on the body, and so it's going to blend right into the IT band portion of the lateral fascia, or the lateral anatomy train. So I just want to release the peroneals. We don't really pay attention to our peroneals that much, but they are going to be involved in that fibula movement on the outside of the leg. And I'm just going to find any areas that are tense and just pump my foot up and down to mobilize that area. And then again, I'm going to do both sides. So I'm going to take that double lacrosse ball. I'm going to go all the way up to the top of the fibula head, but not over the bone. I'm going to stay on the meat of the tissue, or the muscle. Okay. And so you can see what I'm doing. I'm applying that pressure, and then I'm just pumping that ankle up and down. Okay. After that, going right up and back into the hip to release the lateral line, I'm going to go on my glute medius. So I'm going to find the top of my hip bone. I'm going to find that bony structure that is sticking out, and I'm going to go on the glute medius, and then I'm just going to then go, my back leg is going to be planted on the floor, knees up towards the ceiling, and I'm going to release the glute medius. So this is part of that lateral fascial anatomy train or line. And then I'm going to apply pressure, and I'm going to go through that running movement, bringing my leg up and coming down. so that I can get that active release before I take off for a run. Okay. Then I'm going to go right up into a butterfly release, and I'm going to go all the way down to the buttocks, the bottom of the butt, and then to the top. So there are a bunch of hip rotators back there, and your glute max overlies the top of that. That's going to be the largest muscle in the body. So I'm going from my piriformis, that top rotator, and then going right around, right down into the gemelli and the obturators, internal and externus obturators. But the external obturator is going to be down low. And if there's areas of tension, I'm just going to lift that knee. I'm going to stretch these areas after I release. And then we'll go back down and stretch the calf. So then I'm going to go right to the other side, same thing. I'm going to release my glute medius. My back leg is going to be rested with the knee facing up. And in a lot of areas that I'm working on and going through, I've found that it just helps with different injuries and problems. So I use them to prevent injuries. And then same thing, I'm going to then go right up into my glute release and go work my way down the buttocks from the top down all the way to the bottom on that outside part of the ischium. And these are just landmarks, so I'm just applying pressure on my buttocks and going through different regions. And then holding where there's any tenderness or tension. Woo. And then just releasing that. Then I like to go right into a stretch for that. And that is just going to be, I'm going to stretch that lateral line and up all the way into the buttocks. So I'll just forward fold here. And I'm going to stretch that. I should feel that in the buttocks area. And you can also feel it on the outside of the leg, depending on how tight it is. And just holding that here. And again, I'll hold a little bit longer, 30 seconds to a minute. And then bringing my chest, rotating over and coming down. You may find that one side is more tense than the other, and you can spend time to balance that by doing the release and then stretch. And if one side is more tense than the other, then hold that one for twice as long as you do the other so that you can balance your body better. And then switching and going back and rotating. And there are so many different stretches and that you can do. These are just some of the highlights that I will go through and address so that I can avoid some common running injuries. And then switching back. And then taking nice deep breaths. Allowing your chest to sink down. And then coming up. I'm then going to go into a V stretch, and I'm going to forward fold. And that's going to get the inner part of my thigh. So I'm going to get this inner part. That's going to go right up into that iliacus portion. So I'm going to hold that. This helps keep the back healthy with a repetitive movement. And then I'll take my toes and point them up towards the ceiling. Relax. Pull my toes up towards the ceiling. Relax. Pull my toes up towards the ceiling. Relax. coming back up. And last one.
Pulling my toes towards the ceiling and relax. Pulling my toes towards the ceiling, relax. Pulling my toes towards the ceiling and relax.
And the last thing I'm going to, or one of the last things I'm going to do, is then go into stretching the whole back line, and I will put one leg down, hook the other side, and stretch the calf all the way up into the hamstring, and then get the shoulders to stretch as well. That's going to help me with my lats. And then switching to the other side, holding that. Taking nice deep breaths. Switching. And one more. And to leave you with this last release and stretch, it's going to be the Latissimus Dorsi. So every time we rotate our body, the Latissimus Dorsi muscle, it goes from the shoulder to the back, and it's part of that rotation. I like to balance that now. For years, I had an imbalance, so I've been working on that as well. And so before I go out for a run, I am going to roll the outside along the rib cage up to the armpit, and that is just going to address any tension in that Latissimus Dorsi muscle. And you may find that one side is more tense than the other. There is a pre and a post check that I do to balance this area, and I will address that in another video, as that is an important muscle to target. And then onto the other side. And this allows for the rotational portion of running. A lot of, most of the energy comes from the rotation at T12, so the very bottom of the thoracic spine. That is going to be where the energy is generated for allowing the body to rotate, and the legs and the arms then go along for the ride. So a lot of the power and energy comes from the core, that rotation, and then that propelling forward using the hip flexors. And a lot of the hips or the muscle power is going to come from the hips. You want to keep your ankles relaxed when you run. If you keep stiffness in the ankles, you can develop problems such as Achilles tendonitis and lower leg injuries. Okay, so that is going to be the release to the lats, and then I can rotate and check my rotation and see if that feels balanced. So my next check is just to go ahead and start from a low position, and then I'm going to jump up. I'm going to come all the way down and jump up. And if I have no pain when I do that, everything feels good, loose, I'm ready to go, that is my pre-run workout or pre-run routine that I will do to
allow myself to run and feel good with no pain, and hopefully prevent any overuse injuries that may occur with the movement of running. So I hope this is of help, and enjoy your run. Have a blessed day.